Dr. Sundberg here, and today we are going to be talking about whether an injury is in need of ice or heat therapy. This is an all too common question that we hear at our office, and there are several simple guidelines that will help steer you in the right direction. First, let's cover the individual benefits of both therapies, starting with ice. Ice is wonderful in the acute stage of an injury as it reduces your metabolic rate, reduces inflammation, circulation, muscle spasms, and even pain. These are all very helpful when you're trying to prevent microtraumas, and especially when you want to keep the joint from swelling excessively. During the acute phase of treatment, we simply want to limit the damage being done to the area, which ice is great at. The negative aspect of ice is that since it is slowing everything down, it is not allowing the healing process to occur at its normal rate either. Next, let's talk about heat therapy. Heat has just as many benefits as ice, but they need to be utilized at different times. Heat is going to dilate the blood vessels, allowing more oxygen and nutrients into the area, and this is wonderful as it helps the body heal faster while also offering pain relief as it loosens up the tight muscles and stiff joints. In conclusion, we want you to use ice in order to slow down damaging processes happening to the affected area, and we want you to use heat in order to increase healing in the affected area, and both need to be used at the appropriate time. During the acute phase of the injury, or anytime there is swelling in the area, we want you to use ice, and then once we have the swelling under control and we are ready to heal the area, we want you to start applying heat. I also want you to be careful not to utilize either for too long in a sequential treatment, as you can damage the tissue by freezing or burning it. If you have any questions on whether or not you should be using ice or heat and for how long, ask either one of us or another healthcare professional. Also, when you're using ice, make sure that you don't use it for too long in one treatment, because then you'll start having the opposite effect. See, when we ice for too long, our body starts to realize that is getting too cold, and it'll actually dilate those blood vessels again, send more blood back into the area, and can actually increase swelling as a result. So don't do that. Thank you for listening. Hope you're having a great day.